everyone, Dr. Caitlin Butler Birmingham, aka Dr. K, naturopathic sports medicine doctor. Today talking to you about safe squat technique. So what we're going to be covering today is positioning, what you need to watch out for, different cues, the breathing. So let's get started. So you'll want to have a chair or a bench to work from when you're really just starting out with this. And I'd also say warm up for 5 to 10 minutes before you try doing this. That way the legs are warm, you know that you're achieving your full range of motion and being safe that way. So when you're setting up, the starting point is usually hip width apart for your feet. So start with that and see how you feel. So if you sit back on your chair, and that's how you want to think of the squat, is like sitting back, have a look down and see if your knees are passing your toes. If you see that they are, that means that we need to adjust the foot positioning. So try it out a few different times until you feel comfortable and your toes are pointing forward. When you start playing with the toes being more to the outside, you're working a different muscle group. So for now, let's just keep the toes straight forward, knees straight forward. So once you feel like you're comfortable, you're looking down, you're seeing that your knees are not passing your toes, they're kind of hitting the midline of your shoe. Then we can focus on other cues. So when you're sitting back into the squat, you're using the bench or the chair to give you that sitting back feeling. You want to make sure to stay nice and tall in the chest. So instead of sitting back like this, you want to make sure that you're sitting back but still staying upright, trying to remember to keep your chest up to the ceiling. And then when you're pushing up from seated, you want to have your weight in the heels and use that to push up. Because when you get to the top, you want to do a little butt squeeze. Make sure you tighten up the glutes, because that's what you want to focus on. So this is quads, glutes, a little bit of hamstrings when you're doing the squats as well. Breathing. So from here, when you're at the bottom of the pose, you're going to breathe in and breathe out as you come up. So in, out as you come up. So once you get comfortable with that, take away the chair, right? And see if you can get comfortable in your position, toes are forward, knees are forward, and you can still sit back and get to that same angle that you were when you were in the chair. The other thing to consider is when you're sitting back, you do want to come down so that you're making a 90-degree angle with the knee there. Now, if you're a power lifter, you will see them get pretty low and even a bit below the 90-degree mark with their squats. That's a different story, but when you're very first starting out, keep it to the 90 degrees, especially if you've had a previous knee injury. Other things to try, for example, if you do feel like you're not supported if you take the chair away, is sit in the chair, get comfortable in that squat position with all your cues, and then practice hovering just above the chair so that you know, okay, for sure I'm there, I'm sitting back, but you're not letting any of your weight touch the chair. That's another way to do it again, just to make sure that you really are sitting back. So those are the cues for the squat. Alrighty guys, so the main things to remember with safe squat position is that you can still do squats even though you've had a knee injury. The main thing to remember is never let the knee pass the toes, push from the heels, and make sure that you're at a 90-degree angle at the knee. And that will be your safest and best bet when you're first starting out. Weights in the heels, breathing in at the bottom and out as you come up. Alrighty, I hope you enjoyed and I'll see you next time.